Infectious diseases are so closely tied to rural poverty that the answers to solving these challenges are really going to come from a combination of bringing new knowledge into settings where human behavior plays a significant role.
I trained in Ghana and I worked there as a medical doctor for several years before coming to Yale. So in a way, I had seen the problems firsthand, especially with the healthcare system.
I've spent more than 20 years running my laboratory focused on diseases that really don't occur in the United States anymore. And my colleague, Dr. Paintsil, whose work focuses on pediatric HIV, was also feeling as though it was time to move from the laboratory into epidemiology research.
Mike had been looking forward to the opportunity to really do work in Africa. So we just bonded on that shared vision of one day doing work in Ghana.
It became obvious that if we really wanted to know whether the work that we were doing in the laboratory had direct relevance to human disease, we had to identify a way to get into the field.
We spoke with some collaborators at the University of Ghana Medical School and the University of Ghana itself. And that is how the partnership started.
And so it was in 2006 that we made our first visit to the University of Ghana in Accra. And were able to make connections to people who were interested in developing international collaborations.
I was intrigued by the system at Yale that physicians were scientists. Most African countries, doctors see patients, they don't do science. We realized that there was a capacity gap, and then we needed to really build a research capacity.
Our program in West Africa has been actively training young scientists interested in global health research and even clinical work for the past 11 years.
The trainees that we select are people who have promise and potential to make a difference in their countries. We've now had about 40 trainees from Ghana, and about 95% of them are back home in Ghana doing research that they started off from here.
And while here, they're able to study under the guidance of Yale faculty. They're able to take summer courses that are offered through the university and use this experience to hopefully inspire them to pursue a career in biomedical research.
Within 2 years, other universities have heard of us. We got a call from King Saud University in Saudi Arabia that they wanted to be part of our group. And then we also connected with University of Sao Paulo in Brazil. We were able to share some of the work we were doing with Ghana. The way we set it up was actually just building a network of premier universities in the world to help build research capacity and enhance sort of international understanding. It's amazing when you bring these trainees to Yale here over the summer and they interact with Yale students, Yale postdoctoral fellows, Yale faculty. It makes them see that, oh yes, we can do this, that we are about the same, we share the same humanity and knowledge. And then they quickly realize that it is just the resources that they don't have. And they go home very excited.
I think it's absolutely essential that we be working together with investigators from these endemic parts of the world so that we can really make sure that we're addressing the right questions and that we're using all of the available knowledge to make progress.